Welcome to the HealthspanMD Podcast. Hi, I'm Dr. Robert Todd Hurst. Welcome to the HealthsPan Podcast. Did you know the average lifespan is about 4,000 weeks? That's a number that will get your attention, but here's the important thing to know: that's average. And those who make it to the top 5th percentile in longevity add an additional 10 to 14 years to their lives. On the HealthsPan Podcast, our goal is to give you the best chance at achieving those additional 10 to 14 years or more by making longevity simple, so you can have the information you need to work smarter, not harder. And the best part, we do this in less than an hour. Today, we're sitting down with Dr. Michael Eckersley, a cognitive psychologist and professor at the University of Kansas. And what we're going to talk about is coronary artery calcium score. Not Dr. Eckersley expertise, but he has special insight that he has graciously and generously agreed to share his story to help others. This will be a masterclass on what to do if you get the challenging news that you have a high coronary calcium score. Michael, welcome to the HealthsPan Podcast. We're really grateful to have you here.
Thank you very much, Dr. Hurst. It's a pleasure to be with you today.
Well, let's start with your background. Tell us a little bit about yourself, your career, and your personal journey with heart health.
Well, I didn't realize this journey that I was on until just maybe about a year and a half or two ago, when I suddenly discovered that I had a high calcium score. I thought I was doing pretty well physically, long time runner and so forth. And then within the last couple of years, what happened, my normal routine of running about 4 miles a day for 20 years or so, and being able to accomplish those 4 miles in about 40 minutes. So you can do the calculation on miles per minute, it's suddenly I was only able to cover about half that distance in those 40 minutes. And that was a fairly big shift for me. And I was kind of puzzled by it. And I didn't have any other outstanding symptoms or anything, but I decided, probably due for a annual physician's checkup. And it just so happened that I'm part of, or my general practitioner, she recommended that I get a scan. Her office also happens to have a imaging center and so forth. So they scheduled me for a scan, and it was a CT scan. And it was kind of shocking when I got back kind of the results. I had no idea that this was something that I was dealing with. And it was pretty conclusive, pretty reliable. And so I had to study up and, do a little bit of research on exactly what this entailed. And so I found suddenly I was on this journey, and I realized that journey had been started years before in the building up of calcium or calcification in my arteries.
Yeah, so I want to do a little deeper dive into that. So, the importance of the coronary calcium score is in identifying risk.
Right.
Predicting risk in heart disease is challenging. We have all these algorithms and calculations that we can do, but those are really great in populations, but in individuals, it can be limited. And, in your case, you've been running 1,000 miles a year for 20 years. You meditate, you've taken your statin, you've done all the things that you knew to stay healthy. But, your doctor, being very insightful, intuitive, said, okay, but you know what? I know there can be some things that we don't know. Well, let's consider doing a test for some early detection. And I also want to emphasize how valuable that is, because if we were doing early detection for something we couldn't impact, there's not much value to that. But that's not the case with artery disease or heart disease, how we want to phrase this. Like, when we know somebody's at higher risk than we'd otherwise expect, we're really good at stopping artery disease and even regressing that. And so, your doctor, I think this was a blessing. Like, I think you had a really great doctor who said, okay, let's take a look at this. Let's see if we can gather some more information. You were insightful enough to say, okay, I'm going to pay the $100 or whatever it was to get the test. And then you got this result. Tell us a little bit about what that was. Like, I'm sure it was quite a shock when you had this 700 score.
Yeah. And of course, I didn't know exactly what 700 score meant. And so I, of course, went online and found all kinds of information as to what is sort of the norm in terms of calcification. And I realized I was on the higher end of things. And so I scheduled an appointment with a cardiologist in Kansas City, not far from where I happen to live. And I just, and he didn't really tell me anything I hadn't more or less found out online. And he didn't seem to provide me with any specific treatment plan. So that was a puzzling thing to me, because normally you expect, after you have a diagnosis, some sort of treatment plan. I was under the impression there's no way to treat this. So I'm kind of, in a problematic situation. So rather than go back to the cardiologist, I started doing my homework, and I worked probably over a couple months just trying to find maybe cardiologists of a different stripe, if as it were, maybe could kind of help formulate some sort of treatment plan or preempt, worsening. And then suddenly, just this past summer, literally about 6 months ago or so, I did another CT scan, and the number had gone up. So it was now, another 100 or whatever, I can't remember the number of points, and that's when I happened to find out and take it really serious. I had to find somebody who could help me. And suddenly, Dr. Hurst, your name popped up on a Google search.
Well, I'm grateful for that.
Yeah. Well, there are other cardiologists who practice some form of preventive care, but just, reading up on your approach to things, this seemed to be a fairly significant, difference from the norm. And so that's when I decided to schedule an appointment, fly down to Phoenix, and talk to you. And I found it to be super helpful. I will tell you, because you actually had information for me that I had not been able to find anywhere else. So that gave me some hope, which is a big deal,
We'll get you back to the podcast in just a moment, but I want to invite you to take the longevity quiz. It will tell you your best opportunities and potential threats to achieve your longevity goals. Just go to HealthspanMD.com. Now let's get back to the podcast. Yeah, I think your experience is not an uncommon one. Cardiology is still trying to figure out what to do with the results of the coronary calcium score. And a couple of things I want to do a bit deeper dive on for you. You had been on a statin before the calcium score, correct? And about how long had you taken a statin?
Oh gosh, I think for probably 2 or 3 years or so.
Okay, so it wasn't decades of time. It was 2 or 3 years. So presumably your cholesterol was at least at a level that your doctor said, "Hey, I think lowering that cholesterol would be of benefit to you." Right. I also in the cardiologist visit when you had was there any recommendation for a heart catheterization or an angiogram? Is that something that was discussed?
No, absolutely nothing. In fact, what he did, he recommended I get on a sleep study. And I thought to myself, or I actually posed the question, what does that have to do with a cardiac problem? And there may be some correlation to, sleep apnea or something, but frankly, it didn't exactly address my need.
Yeah. And one thing that the reason I brought up the angiogram is because I've had that experience that a lot of people we'll see a cardiologist with a high calcium score, and the next step is a coronary angiogram, which,
Right,
you know,
right.
can be the right approach. And I'm
Mm-hmm.
not saying that that's never the right idea, but it doesn't necessarily need to be that way. And, you know, for us, as I recall, I said, well, let's find out if we need an angiogram with you. And we
Sure.
had you run on a treadmill test, and you
Mhm.
passed that with flying colors, which gave me a lot of confidence that we
Mhm.
could work on your prevention regimen, that we didn't need to, you know, treat any blockages or anything along those
Right.
lines.
And the other puzzling factor in my mind was that actually my cholesterol was relatively low.
Is that right?
So
Yeah.
yeah, and in fact, quite low and non-concerning at all. And so I was trying to figure out exactly how did this calcification ensue,
Mm.
when it happened to sort of catch on and start accumulating, and then why is my current cholesterol not so problematic.
Yeah.
It had to come from somewhere. So I was, in a way, it was like I was having to do detective work and on my own to some extent. Fortunately, I have an excellent GP, and she gave me good care. And now I am, I'm kind of on a plan. I have a plan to try to, get on top of this and get it under control as best I can.
Yeah, and I'm very optimistic about the success
Mhm.
of that plan. I do also want to talk about the repeat calcium score. You know, your
Mhm.
experience is uh, everybody's experience, frankly. Like, if you have calcium one time and you repeat the scan down the road, it's going to be higher. Like,
Yeah.
that's almost universal. It's not a tool to assess the effectiveness of your prevention regimen.
Right.
It's it's more complex than that. And I think that's a complexity of coronary
Mhm.
calcium that people have a hard
Yeah.
time grasping, because we're looking for calcium, but calcium's not the problem. You know, that's
Right.
that's
Right.
old healed artery disease, but it's easy to see, and
Yeah.
it's very predictive of outcomes, and so
Right. Right.
helpful in guiding that approach. What was your when you first got the 700 score a year, more than a year ago?
Yeah.
What was your you went and saw a cardiologist, didn't get a lot of insights there. What was your mindset at that time? Like, what did you say? Okay, well, this is what I'm going to do, or did you have any
Right.
strategy at that time?
Well, the thing that intuitively in my own kind of uh, non-informed mind was that, oh, okay, so I'm a 700. It's almost like in my mind, simplistically, is, oh, well, that my temperature is such and such, my body temperature. So if I get a much higher temperature, that shows progression and worsening of the situation. And so in a way, I had to sort of be talked down and sort of explained that second CAC score, it's probably going to be higher. In my mind, I just had to sort of turn off that little button and say, oh, it doesn't necessarily mean progression. It just kind of reinforces, I guess, the validity of the first diagnosis, or the first score, if you will. So that was a learning experience.
Yeah, I've seen that a lot, and unfortunately, the usual outcome of a repeat score is more angst, more fret, and it shouldn't be,
Yeah.
oftentimes. So, so you flew down to see me. We talked. You said that you came away with hope, with some peace of mind.
Mhm.
Tell us a little bit about that. Like, what were the things that you learned that you felt were most insightful? And then we could talk about what you've done since that time.
Well, the thing that was really quite interesting to me is you seem to, I guess, in your practice, in your care, you have this sort of long, how should I say, an integrative approach to your treatment, in that you think of it in terms of long care perspective and not simply um, short-term tactics and so forth. And one thing that stood out in what you told me was that, oh yeah, actually, you could probably build some muscle. That would be a really smart thing to do. And to me, I would just figured, well, I opt for, you know, working on, long distance running. I like to have my blood pumping and so forth, and that's good enough. But then I realized I really did not have great muscle tone, throughout my body, and you felt that I should, really work on that aspect. So you're kind of looking at the whole body, the whole system kind of situation, which I had not factored in. And so I came back from that particular trip and I started taking it seriously. And, I played football in high school and wrestling and all that. And I'd done various, physical things and lifted weights. And then I became aware of the kettlebell. And I don't know if you know anything about that, but it's not just lifting dead weights and so
Right.
forth. But so I did some research online and found out just excellent resources for how to really learn how to exercise with the kettlebell. It's basically weight, varying degrees of weight and so forth, but also it's a form of exercise that's very dynamic using weights. It's not just lifting, repetitively. It's basically moving around a lot and, moving the weights around your waist or around your head and various kinds of things. You're moving, you're stretching, you're doing all kinds of sort of kinetic activity. And I tell you, man, it just feels so foreign to me to actually be building a bit of muscle. I'm not going to get muscle bound anytime soon, but just this morning, I, ran my 2 or 3 miles, and then I did about 40 minutes of exercise with a kettlebell, and it was great. It's not like you're trying to lift heavy weights, but just trying to get a lot of movement and repetitions. And after a while, you really feel like you had a workout, And for a guy who's been, kind of neglecting muscle tone, that kind of thing for a long time, I felt much better about that. And if it helps my overall health, then awesome, so that's encouraging to me. So I'll do whatever it takes, man. I mean, I'm super motivated to, get on top of this as best I can. I'm not going to live forever, but I'd like to be able to sustain kind of a healthy lifestyle as long as possible. So I just turned 70 this year. And so suddenly it's becoming more, how should I say, more relevant to me to be in good shape.
We'll get back to the podcast in just a moment. In the meantime, I'd like to invite you to be a patient in the HealthspanMD practice. Our goal is to add a decade or more of healthy, vibrant years to all of our patients' lives. If you're interested in that, just go to HealthspanMD.com, schedule an appointment. We'd love to work with you. Now back to the podcast. I totally get that. And I love what you said there. The DEXA scan is what we use for body composition to assess. Yeah. And it's interesting. I learned early on in this not to give my interpretation of it because, we compared you to people your age, and actually your body fat percentages were really low and your muscle mass was well above average. But to you, you're like, okay, that's not where I want to be. And I understand that. And you're right about the kettlebell. Like that can be a really powerful tool. Not only are you getting the resistance training, but you're getting the core, stability training, balance, and it's an aerobic activity as well. It's a high intensity one too.
Yeah. And it's not tedious, it's like lifting weights. I always kind of dreaded that, having to go into the gym and just lift weights. I just found it just deadening, but this is like kind of exciting. I mean, you're moving around, and also I happen to also find a person where I work out. I run on a high school track, I have for a long time. And I found this guy who was like this kettlebell, like all-star type guy, very nice guy. and he introduced the kettlebell to me. And I said, "Oh my word, this sounds really great." And also he had this, epic body, which I will probably never have. But, he had, it was a great example to see, oh, this is kind of like the end product of a guy who's taken this stuff very seriously. So that was also kind of a reinforcement of the importance of getting serious about it.
Inspirational, isn't it?
Yeah.
I will say, I know that mindset of, well, after a certain age, you're not going to be likely to gain muscle.
Mhm.
Kind of that's what we've been told, right? That was
Yeah.
conventional wisdom. I will tell you, in my experience with this DEXA, since I started using this in my practice a couple of years ago,
Yeah.
I am blown away by the amount of muscle people are putting on in their 70s, 80s, and even 90s. There's absolutely not true that at a certain age you're not able to put on muscle. I'm not saying
Yeah.
that it's as easy as it is when you're 20, but it's even more important because we time is trying to take that muscle away from us.
Yeah.
That's that
Right.
that much is true. But you some concentrated effort in
Mhm.
that, like you've been doing, that's going to pay big dividends
Mhm.
for you. And I'll love to see your repeat DEXA scan down the road.
Yeah.
It'll be fun to watch. That's really great. So I will say, I'm pretty sure the American College of Cardiology guidelines for treating coronary artery disease and a high calcium score does not include kettlebells. But here we are. Here's that. We talked about the importance of the drivers of artery disease.
Mhm.
That we wanted your cholesterol, as you'd mentioned, your cholesterol is never high, but
Mhm.
we change our criteria for what is optimal changes
Right.
when we
Right.
understand risk. So we
Right.
talked about getting your cholesterol great, your blood pressure really good, your blood sugar, insulin. Like you mitigated a lot of those with your
Mhm.
healthy lifestyle choices over
Yeah.
time. But now you're adding muscle as well as continuing your fitness things. How do
Mhm.
you feel? Like where do you feel now compared to before you came to visit us?
I tell you, I am, I'm feeling much better about my prognosis, if you will, And I mean, I was just almost starting to count the months, and
Mm,
years ahead and so forth. And at this point, I feel positive enough about, my prospects that I'm not at all depressed or anything. I'm actually pretty positive and confident that there's a future for me and that I can sort of do whatever I can possibly do. I will do it. And so motivation is not really an issue. And I have enough hope that I'm not wasting my time
mm.
that it's going to pay off eventually. So I appreciate, those insights because I was not getting them, from my previous experience with care. And also, once again, a credit to my GP because she uh, she uh, she kind of indicated that there's maybe a different track for just
Mm.
standard cardiology, and that there's a way to look at it slightly differently. So she didn't she didn't necessarily point me to you or to well, she did point me to a cardiologist who was doing some preventive care in his practice, but it was just murder trying to get an appointment with that office. And I was happy to fly down to Arizona just to get into your office, and you ran me through the gamut of different things. I'd never seen half of the kind of stuff that you subjected me to, so it was pretty cool.
We'll get you back to the podcast in just a moment. Longevity is complex, but we make it simple. 3 things: achieve high quality proactive health care, avoid frailty, and avoid cognitive impairment. That's what our practice does, and that's what we help patients do. If you'd like to learn more, go to HealthspanMD.com. Now back to the podcast. Yeah, I knew that we had limited time with you here, and we wanted to learn as much as we could so that really we could give you the control. I
Yeah.
knew your issues were not that I had to motivate you.
Mhm.
I knew that all I need to do is point you in the right direction. Say, here's
Right,
our
right.
objectives. Here's that clear path,
Mhm.
and you took that, and that's empowering, right? That makes you feel good when we feel like we don't have control, which unfortunately that message gets relayed by healthcare a lot, like, well,
Mhm.
just trust us, here, take the
Yeah.
pill,
Right.
and show up for your appointment in 3 months, and
Yeah.
we'll take care of everything. That's not going to be the best outcomes.
Mhm.
It's working as a partnership with us and you. That's when you're going to do the best, and
Yeah.
you
Yeah.
certainly had that experience. What I really, again, appreciate you taking the time. Like, what a generous act to be able to share your story for others who maybe in a similar situation that you were at one time. What advice would you have for somebody who's just learned that they had a high calcium score? What kind of things would you tell them?
Well, probably I would just caution them to not make too many conclusions too early. There's a lot to learn about this, uh, and that fortunately those resources for um, getting acquainted with accurate information are available. Some of it is online, but it's also helpful to find good resources that are reliable and qualified, valid resources of information, because there's all kinds of funny things that you can find on social media and such. But I would I would seek out somebody who approaches the situation of care for people with coronary artery disease, somebody who's actually working in the preventative realm and thinking sort of long term into sort of whole body medicine, and not just obsessing, let's say, on the heart or the coronary arteries, but sees it as you know a systemic care issue. And because it affects your mental health as well. I mean, if you happen to get depressed and anxious and so forth, that's not always a good thing too. So you have to stay fairly positive, so as not to let it become a little bit too overwhelming. And so,
Mhm.
because you have to also explain your situation to your family as best you can, and you don't want to, paint a bleaker picture than maybe is absolutely necessary. You want to give them some confidence that you might actually be in fairly decent shape for some time to come. They don't have to write you off quite yet.
Yeah. I think that's one of the things I always try to impart to a patient who has that, experience is
Hmm.
let's frame this as a blessing, because instead of finding out that you're more likely to have some heart issues by you having a heart attack, we
Hmm.
found out by you having a CAT scan. And
Yeah,
and
right.
that and again, we're really good at preventing problems
Yeah,
in people when we know what their risk is. So
yeah.
that's such great advice, and it's been such a pleasure to meet with you, to be a part of your journey in this as well. And Dr. Eckersley, thank you so much for joining us today, and thank you for everything that you've shared with us.
My pleasure, sir. Thank you for your help.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or a procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience health care as it should be.